Hello, and welcome to this EpiPen Adrenaline Auto-Injector training. This video will show you the main features of the EpiPen, how to correctly administer your EpiPen. Watch this training often. Show it to your friends and family or teacher in order to ensure that you are totally familiar with how your EpiPen works. Try using your trainer pen when you watch this video, so you know how to use your EpiPen in an emergency. This is the EpiPen auto-injector. It comes in two strengths. One for patients weighing more than 30 kilograms or approximately 66 pounds or more. It has a yellow label, and one for patients weighing between 15 kilograms and 30 kilograms or 33 to 66 pounds, which has a green label. That's the EpiPen Junior. Both EpiPen work in the same way. For children below 15 kilograms, the suitability of EpiPen Junior has to be judged individually. The use is not recommended in children less than 7.5 kilograms. Make sure that wherever you are, you always have your EpiPen with you. It's important for you to carry two EpiPen with you at all times. What to look out for? The EpiPen is clearly color-coded. As you can see, the safety cap is blue and the needle cover is orange. This is so you can quickly see which end is which in an emergency. An easy way to remember this is blue to sky and orange to thigh. The needle sits inside the orange casing, and this casing automatically covers the needle once the EpiPen has been used, so that you never see the needle. The case also protects you from unintentional needle injuries following use. The viewing window lets you check that the solution is clear and colorless. It's important to do this regularly, as you'll need to replace your EpiPen as soon as possible. If the solution becomes dark or cloudy, the viewing window also allows you to check that you've used your EpiPen correctly. When the dose of adrenaline has been injected, the window becomes darker. As you can see, there's a noticeable difference before and after each injection. The instructions on the EpiPen are easy to read and clearly illustrated. This gives you or someone with you immediate access to the injection technique in an emergency situation. Your EpiPen comes in a hard carry case. You should always keep your EpiPen in the case to protect it from damage and light, which can degrade the adrenaline. Using your EpiPen is easy. There's no need to remove clothing. But make sure the orange end will not hit buckles, zips, buttons, or thick seams on your clothes. To remove the EpiPen from the carry case, flip open the lid on the carry case. Tip the carry case and slide the EpiPen out of the tube. Grasp the EpiPen in your dominant hand with the orange tip pointing down. Remove the blue safety cap. Hold the orange end about 10 centimeters from your mid-outer thigh. Once the blue safety cap has been removed, the EpiPen is ready to be used. Swing and jab the orange tip into the thigh at a 90-degree angle and hold in place for 5 seconds. Remove the EpiPen after use. The orange needle cover automatically extends to cover the needle so that the needle is not seen before, during, or after use. You or someone with you must dial 999. Ask for an ambulance and say anafilaxie. It's important that you don't get up or move around. Stay lying down or seated and have someone stay with you, if at all possible, until you've been seen by a paramedic. If EpiPen is administered by a caregiver, ensure the patient's leg is immobilized during the injection to minimize the risk of injection site lacerations. Do not reinsert the used needle. Unconscious patients should be placed on their side in the recovery position. You can only use your EpiPen once, so hand the used EpiPen to the paramedic. If you're not feeling better, then you may need a second injection with a different EpiPen. This can be given 5 to 15 minutes after the first. The trainer pen works in the same way as the real EpiPen, but it doesn't contain a needle or medicine. Notice that the trainer pen looks slightly different to the real EpiPen. The label clearly states that it's a training device, and the label is light blue in color, while the EpiPen is yellow, and the EpiPen Junior is green. To use your trainer pen, simply pull out the blue safety cap, swing and jab the orange tip firmly into the outer thigh and hold in place for 5 seconds to simulate drug delivery. Remove the trainer pen. To practice again, the trainer pen must be reset. To reset the trainer pen, replace the blue safety cap, place the orange tape on a hard surface, and push down. If you think you have come into contact with your allergen and start to experience severe symptoms, you should use your EpiPen immediately. What to watch out for: difficulty or noisy breathing, swelling of tongue, swelling or tightness in the throat, wheeze or persistent cough, loss of consciousness or a collapse, pale and floppy in young children. And finally, remembering these key points will help keep you safe. Always carry 2 EpiPen with you. Know your symptoms and when to administer your EpiPen. Blue end to sky, orange end to thigh. Check the viewing window regularly to ensure the solution is clear and colorless. Check our expiry date. Ring 999 immediately after administering your EpiPen. Stay lying down or seated until you have been seen by a paramedic. Only use your EpiPen once and hand to a paramedic after use. For further information, read the leaflet in your EpiPen box or visit the EpiPen website. If you have any concerns, talk to your doctor or pharmacist.